Great. Thank you for coming today, and it's really a testament to our community to see so many people that are very concerned about healthcare outcomes here in the Fox Cities. So again, thank you for coming, because what you do every day in the various organizations that you're with, you are providing ways to improve not only the physical health of our community, but the mental health, and you're also here to help with the safety for our kids, and also to take care of some of the most vulnerable people in our community, and that can be the elderly, particularly those suffering from dementia. So you, again, are a testament to the great services that exist out there already, and it's great to see you here because we all know that the work that we're doing isn't by far done. The needs continue to grow every day, whether it's for continued improvement in physical health, mental health, particularly for our children, and then again for our elder care. So those needs will be continuing, and it's great to see so many dedicated people helping those issues. Our next speaker I'd like to introduce is Paula Morgen, and she is the Director of Community Health for ThedaCare, a 7-hospital healthcare system in Appleton. Paula has led the system's community health improvement activities for the past 18 years, including ThedaCare's community health action teams, needs assessment, implementation plans, and community benefit tracking. During her tenure, ThedaCare has been a 2-time finalist for the National Foster D. McGraw Award for Excellence in Community Services from the American Hospital Association. And again, I would just add that ThedaCare is a top-notch organization. I've used them personally and multiple times, either with my kids or myself, and it's always great to get their care. So I'd like to introduce Paula next. Thank you.
Good morning, and thanks to the UW and our legislators for hosting this morning. What a great opportunity to share what's going on here in the Fox Cities area. Before I jump into the slides here, I just want to share a quick story from early in the week. On Tuesday, I was driving home from work, and I was listening to NPR, and the speaker that they featured was talking about how it's like next to impossible these days to get people to change their minds, even with all the facts in the world. We're living sort of in this post-truth era at the time. And what she was suggesting is that really the only way to get people to think about possibly changing their mind is to give them experience, to get to be with people who are not like them, who are living something different than what they experience. And they were suggesting, the speaker was suggesting that we should host more, instead of foreign exchange programs, domestic exchange programs where people in different parts of our country with different backgrounds go and spend time in other parts of our country learning from people. So people of different faiths spending time with people of different faiths, people of different colors with people of different colors, and big city, rural areas, and all of that. And it really made me think that, as I was anticipating today, that's really what I'm here to share with you, is our model of how we go about community health, which incorporates something called the Plunge. And the Plunge is really, instead of a week spending time with other people that aren't like you, it's 8 hours spending time with people that aren't like you. And the amount of learning and understanding that comes from that process is really just incredible. So that's, in a nutshell, what my next 13 minutes or so are about. So we got started with this work right around 2000. United Way at the time approached ThedaCare for additional funding, and we're a huge supporter of United Way. We said, happy to do that. But we recognized our role as one of the largest health systems in the area, and that we really felt that we could do more, and our CEO challenged us to do that. So we gathered some folks together, and we did really kind of what you might expect us to do at that time is we gathered all our experts, our doctors and our nurses and our rehab people and our dietitians, and we said, okay, you guys are the experts, you guys know health, what should we go do to the community? And that was kind of how we were thinking about this work. And these folks came up with some great projects and initiatives, and we went and took them to the community. But we quickly learned that that model isn't very sustainable. So as soon as our focus on certain initiatives in the community, ThedaCare's focus needed to change or move on to some other initiatives, those would die, and they weren't sustainable. We got wind of some work that was happening in South Bend, Indiana, Memorial Health System down there, and what they were doing was really different. They were gathering the community to have dialogue with the community about what creates health. And they were doing some innovative things like downtown South Bend was really a blighted area. And the health system put resources into creating a community center in that downtown area and got people access to jobs and education. It's like, wow, I mean, that was really a novel concept 20 years ago. They also put us onto a fellowship in creating healthy communities, and ThedaCare paid for 2 folks, Dr. John Milkey and myself, as well as Peter Kelly with United Way, and somebody from our local school district to go and learn about, do this fellowship and what it takes to create a healthy community. And my big aha coming out of that was this notion that you can't solve a problem that you don't own. And our false thinking in our early model is that we as healthcare owned health of the community, when in fact, the health of our community is really owned by the whole community. And if you take a look at the UW Pop Health Institute and their model of what creates health, it really fully supports that notion. Only about 20% of our health is actually created through the healthcare organizations in our communities. The rest of it is created where we live, learn, work, play, worship. It's our lifestyle and behaviors. It is those socioeconomic factors like poverty and access to jobs and income and social supports and all of those, and it's our built environment around us. So we knew that our model had to drastically change, and we had to do something that really engaged community in creating common understanding and common learning. So we created something called CHAT, and that stands for Community Health Action Team. This is the mission statement that we have for CHAT, which is that catalyzes through education and collaboration creative projects and opportunities that have the potential to significantly and measurably improve community health. So what is CHAT? CHAT is, we have CHAT teams in each of our communities where we have hospitals. We have one in the Fox Cities and then 5 of our rural marketplaces. And the CHAT teams are made up of anywhere from 12 to about 25 community leaders, and they are from all different sectors of the community. We're not just talking about healthcare, we're not just talking about government, we're talking about faith and education and business and philanthropy, and so all corners of our community. Because when you bring all those brilliant different perspectives together to study an issue in our community, the possibilities really sort of become endless, and the thinking, it gets to be so rich. And the community recognizes these issues as community issues, not just healthcare issues. One of the key piece, I guess, of our CHAT model is the idea of a plunge, and this is what I referred to earlier in my comments, that a plunge is basically, you know, we pick, each of our CHAT teams in those local communities pick a topic once a year, and we take as many people as we can cram on that yellow school bus out into the community to go to several different sites through the course of the day to hear from people living the experience, whether it's domestic violence, or homelessness, or poverty, or childhood obesity, or access to mental health services, or whatever the topic might be. What we do is organize a day to help our community leaders best to get a sense of what it's like to walk in the shoes of people living that problem. We like to have about maybe 30–40% of the folks on the bus for the day being people who are the experts. They get it. They're in the choir. But the rest we want to be people who really need to know about these issues because they have the potential to use their influence to really make a difference. We have done plunges now on, there are about 20 of them here in the Fox Cities over the years. Everything from domestic violence, poverty, childhood obesity, smoking, understanding our LGBT population, understanding our undocumented Mexican population, alcohol and drug use, the list kind of goes on. This is a photo from a plunge we did in 2015, one of our most recent plunges, on what it's like to be Black living in the Fox Cities area. And I got to tell you, it was a pretty powerful day, hearing from people share their experiences of what happens to them on a day-to-day basis in this community. It was eye-opening. So this morning is all about how do we create common understanding and common learning. So the real benefits of the plunge are, first of all, at the end of the day, people get it. You don't have to go boardroom to boardroom to try and convince a bunch of community leaders about the problem that exists. They got to see it firsthand. Secondly, stereotypes just sort of melt away, because all of a sudden now, when you're seeing people and hearing their story personally, you know, we all probably have these stereotypes, whether we want to admit it or not. When you're sitting there hearing somebody's story in person, and understanding the circumstances of how they really got to be where they are, you know, those stereotypes just sort of fade into the sunset. And then passions ignite. It's really hard. I would say it's very hard for any of us as community leaders or for our legislators to go into our community and see the issues and not want to be personally engaged in helping to make a difference. So you walk out of the day with people who want to be part of the solution. As we go into the Plunge experience, we really have 3 different goals. One is just education. If we have 60, 70, 80 community leaders from all sectors who walk out at the end of the day just knowing more about that issue of the day, isn't that fantastic? Because you know they're going to use that knowledge to make better decisions as leaders in our community, whether inside their organization or out in the community. Secondly, and maybe even most importantly, is this idea of connectedness. You know, what happens on the Plunge Day is that you might have a legislator sitting with the person who runs the domestic violence agency, or runs Partnership Community Health Center, or you know, ThedaCare CEO sitting with the leader of public health, or whatever it might be. But all of a sudden, we know each other in our community, and we build these relationships that all of a sudden now you feel like you could reach out and ask somebody a question, or give them a phone call, or you know, we could work on things together, because you start to build that trust and social capital in the community. And people talk about the Fox Valley being this area where you know, it's really collaborative. And honest to God, I really believe that having this chat model in our community for the last 18 years really has had something to do with that. And finally, at the end of the day, we always want to walk out with initiatives. What are we actually going to do about what we learned? And we always gather everybody who attended the Plunge about a week or so later. So we have 60, 70, 80 leaders who all think about this a little differently in a room, and we figure out what can we as a community do about this issue. Not what can ThedaCare do, or what can our government do, or what can United Way do, or but it's about what can we do, because we all have assets and resources that we can bring to the table to make a difference. So some of the things that have come out of this model that exist in our community today, there's lots of different things. I see Beth Clay is here. The NEW Mental Health Connection came out of 2 plunges that we did on mental health and access to mental health. And our chat model paid for about 10 folks to go down to Tarrant County, Texas, to after those plunges, to learn about a model down in Texas. And we brought that model back, and that's what the NEW Mental Health Connection is today. And it connects 64 different mental health agencies. The Rural Health Initiative takes healthcare services to the farm in Shawano and Outagamie counties. That came out of a plunge that we did on the health of our rural farm families. Our Waupaca chat team recently a couple of years ago, did a plunge on drugs and alcohol, and that community didn't have a drug court. So as of actually this month, they are now starting up a drug court that came out of the plunge model. It's also one of the first sites in the state that started to use recovery coaches, which now is best practice, but it was one of the first areas to use recovery coaches. The Fox Valley Advanced Care Planning Partnership is a group that came out of plunge we did on end of life, and recognizing that so many people are dying without having their wishes for really how they want to write that last chapter of their life known or respected. So Ascension, ThedaCare, Mosaic Family Health, and the End of Life Coalition all came together after that plunge to create one organization to move a common vision forward for how we can work together both inside our healthcare institutions and in the community to help make that possible, living with more dignity at end of life possible. And Voices of Men. Hopefully you've heard about Voices of Men, about ending violence against women and children in our community. Another example that actually had a small start going in the community, but we did that plunge on domestic violence that just ignited the work and the interest behind it. And now there's 1,000 men who gather every fall to help create a different culture that respects women and children. Common Ground brings clergy together. A bunch of faith leaders got together after a plunge we did on diversity, and these faith leaders wanted to work on language and helping people learn the English language after a plunge we did in diversity. They decided they liked actually working together. So you have Muslim and Jewish and Catholic and Presbyterian and Methodist and a host of different religions around the table, but they put their theology aside and said, we want to be part of helping this be a healthier place for all. So they follow every year the chat topic that happens in the Fox Valley, and they work in their congregations to spread the word about that work. So last couple of points here. It helps to have some funding with this, and we're fortunate enough through ThedaCare that they put aside a portion of their margin every year to support this work. We have a fund in the Community Foundation here, as well as one within our organization. So we are able and in a position that when our community has great ideas, that we can put some seed money on the table to help make those ideas become reality. And last slide, keys to success for this. So again, this morning is all about creating knowledge and understanding, and how do we spread that. So I think that this model is one that, because of the sheer number of people in our community that it engages from all sectors, it just innately creates that common understanding and shared knowledge that happens. So that's a huge key to this success. We have paid staff to support the work, so the ideas that come out of it, we have people who are there being paid to kind of dog the work and make sure it happens, which is a big difference from many of the efforts, good efforts in our community are volunteer-led, lots of great hearts and great people who want to do good work, but they also have day jobs, and that's a real difference with the model. And finally, we have some resources to be able to put on the table to help spark the ideas, and it sends a message to other potential collaborators that we're serious about the work. So that's our model. Look forward to your questions later. Thank you.